Welcome viewers, myself Dr. Ajantha Shivaji Kotekar, Professor and Head, Department of Roganidhana and Vikriti Vijnana, Yenepoya Ayurveda Medical College and Hospital. Today I will be dealing on the topic increased uric acid, hyperuricemia, pathya and apatya. In the current clinical practice, we find plenty of patients coming to us, especially the youngsters, complaining of pain in the small joints. And on evaluation of their serum uric acid, we find plenty of patients having increased serum uric acid. And this particular condition is called as hyperuricemia. And the patients keep on asking us about different questions about what is hyperuricemia, how is it caused, then what are the things they require to abide by, and what is the pathya and apatya. Hence, in this particular presentation, I will be presenting on definition of hyperuricemia, classification and effect of hyperuricemia on the body, mechanism of uric acid production, excretion and maintenance of its balance in the body, concept of pathya and apatya, and finally the apatya in hyperuricemia, or those things that one should avoid if they have hyperuricemia. The first question is, what is hyperuricemia? Hyperuricemia usually is defined as a uric acid level that is higher than 7 mg per dl. It is determined based on the uric acid solubility capacity. That is, this represents the solubility limit of urate in the plasma at 37 degrees centigrade. And the level beyond 7 mg per dl result in supersaturated solution which are prone to crystal formation. And this definition could vary slightly depending upon the laboratory norms as well as the test methods. Generally, the accepted range for uric acid is somewhere between 3.5 to 7 mg per dl in men and in postmenopausal women, and 2.6 to 5.7 mg per dl in premenopausal women. Here, it may be noted that in the premenopausal woman and postmenopausal woman, the general accepted range slightly varies. This difference is observed between men and women is attributed to estrogen stimulating effect on the uric acid renal excretion. The next question that arises, what is the relationship between the serum uric acid level as well as the symptoms manifested? As we have already discussed, above the threshold of 6.8 to 7 mg per dl, the risk of serum uric acid crystallization increases significantly at 37 degrees centigrade. Hence, hyperuricemia may be classified as symptomatic and asymptomatic. Symptomatic are those where the patient has got a high serum uric acid level more than the normal physiological limits, which is accompanied by the symptoms of gout, urolithiasis and acute urate nephropathy. On the other hand, we have asymptomatic uric acid increased patients where there is increased serum uric acid level without any of the symptoms present in the patient. Elevated serum uric acid levels may cause silent tissue damage, and also it increases the risk of several diseases such as hypertension, hyperlipidemia, obesity, metabolic syndrome, type 2 diabetes mellitus, cardiovascular disease and chronic renal diseases. Now, the question that is valid is, where is the uric acid produced in the body? Majority of the serum uric acid comes from the endogenous sources, that is from the breakdown of nucleic acids. And uric acid is a weak acid that is generated as the final product of the metabolism of the purines, which form important biological particles such as DNA, RNA, ATP, GTP, etc. The daily endogenous purine production is estimated to be around 500 to 600 mg. The daily intake of exogenous purines in the sense the purines which are ingested from outside the body. The daily intake of exogenous purines with the diet is approximately 100 to 200 mg per day. It is worth remembering many of the additional factors influence in transient fluctuations of uric acid levels like exercise, diet, drugs, state of hydration, etc. It is worthwhile having a question, how is uric acid balance maintained in the body? Always we should remember, kidney plays the key role in maintaining uric acid metabolic balance. And 90% of the cases of hyperuricemia is caused due to inadequate renal excretion. And only 10% of the cases of hyperuricemia is due to overproduction of uric acid. Therefore, it is very clear that kidneys eliminate about 2/3 of uric acid produced daily, and remaining only 1/3 is removed through the digestive tract. Hence, the imbalance between the uric acid production and elimination is dependent mainly on the kidney excretion, and any imbalance between the production of uric acid and elimination through the kidney results in hyperuricemia. Through this flow chart, let us try to understand the uric acid metabolism. As I have already mentioned, uric acid is produced in the body by the breakdown of purines. Therefore, purines on breakdown produce uric acid in the body. And these purines in the body are derived from two sources. One is endogenous sources and the exogenous sources. Endogenous sources are those sources within the body which will break down to form the purines which will break down to form uric acid, and exogenous sources usually are contributed by food. Therefore, the endogenous sources and exogenous sources which contribute to purines are further converted into xanthine, and in the liver, the xanthine oxide converts it into uric acid. And this uric acid that is produced in the body is excreted through kidney, that is around 70% of uric acid is excreted through the kidney, and around 30% of uric acid that is produced in the body is excreted through the gut. Hence, maximum amount of uric acid that is produced in the body is excreted through the kidney. Hence, it is noteworthy that around 10% of the cases of hyperuricemia is due to overproduction of the uric acid, and around 90%, that is majority of the cases of hyperuricemia, is due to reduced excretion of uric acid through the kidneys. Hence, overproduction or reduced excretion both contributes to hyperuricemia. Now the question arises, or the common question that is asked by the patients: what is the patya and apatya that has to be followed in this particular condition? One has to always remember the importance of patya. Ayurveda says, pati sati gadartasya kim aushadam nishevanaihi, apati sati gadartasya kim aushadam nishevanaihi. In the sense, when a person is suffering from a particular disorder, patya has to be followed. If patya is not followed, and if only medication is taken, then the disease would continue. And if patya is followed, then there may not be the requirement of the medication, because the patya itself can give lot of positive effects. So, if there is a hereditary predisposure of causation of hyperuricemia in the families, then one should always remember that prevention is better than cure. Hence, as we have discussed in the previous slides, one should give much attention to the health of the liver in particular, as well as the health of the kidney and the food intake, particularly those food which are rich in purines. And any substances that are responsible for increasing the uric acid in the body are considered as the etiology for uric acid production, and they are identified as the nidana. And all the apatyas that are consumed by an individual form the nidana or the etiology or the causative factor for the production of uric acid, and very particularly here it is the purines. Hence, in Ayurveda, the first line of treatment is nidana parivarjana, that is, one should avoid all the etiological factors that is responsible for the causation of disease. Hence, here a patient who is suffering from hyperuricemia should avoid intake of purines as the first line of management. Hence, in this particular presentation from here onwards, let me discuss on various exogenous sources which are consumed by the person, which are apatya, which results in increased uric acid and thereby contributing to hyperuricemia. Most important is the meat. Among the meat, organ meats have high purine content. Organ meats include liver, heart, kidney, brain, etc. of the animals. So it is always better to avoid such organ meats. Further, red meat like beef and pork in general and bacon in specific have high purine content. So it is advisable to avoid these also as far as possible. Some people, if required, may consume very little amount of poultry items like chicken and turkey. Seafood also contribute towards high uric acid because the seafoods are rich in purine content. Therefore, avoid following fishes as they have high purine content like crab, shrimp, tuna, herring, salmon, lobster, sardine, mackerel, halibut, etc. Fruits may also contain high purines and may aid in increasing uric acid in the body. Hence, it is advisable to limit the intake of dried dates, dried figs, banana, avocado, apples, kiwi, gooseberry, pineapple. It is better to limit consumption of naturally sweet fruit juices. Products rich in fructose are not a direct source of purines. Their consumption can increase serum uric acid production by intensifying the adenosine triphosphate degradation. Vegetables may have high purines but not as high as meat and seafood. Hence, it is better to avoid mushrooms, beans, lentils, cauliflower, spinach, black gram, peas, broccoli, carrot, etc. as far as possible. Fermented foods also have high uric acid. Food products having high yeast content like bread, etc., alcoholic beverages like beer, etc. may be avoided. Fat intake is also not advised to the patient because that also can contribute to high uric acids. Hence, it is advised to limit the intake of high fatty food like salad dressings, ice creams, desserts, gravies enriched with fat, fried foods, dressings, fried snacks, chips, etc. One should limit the use of sugar or intake of sugar because sugar also contributes to high level of uric acid in the body. Hence, it is better to limit sweetened foods, sweetened beverages, sweetened cereals, sweetened bakery products, cakes, pastries, cookies, donuts, candies, confectionaries, etc. It is advisable to limit protein-rich vegetarian sources like soya, paneer, dal, very particularly arhar dal, rajma, kabuli chana, etc. because all these also contribute to increasing the uric acid in the body. It is always advisable to avoid fast food and junk foods. So to conclude, body requires uric acid to maintain blood vessel health and other processes. An abnormal increase in uric acid contributes to gout, diabetes mellitus and cardiovascular diseases. In general, as Pathya, in uric acid conditions like hyperuricemia, avoid purines. Limit intake of animal proteins, eat more vegetables, drink plenty of water, moderately exercise between 30 minutes to 1 hour each day like brisk walking, sports, cycling or swimming, etc. Thank you.